Did you say Jeff or Joe?
Jed.
Jed.
My name is
Jed.
Jed Winkel, and
I'm
he's hitting the road already.
I'm hitting the road, but I'm very sorry that I'm missing this.
That's okay.
But
Yeah.
I think it's wonderful program.
Thank you very much.
You have it on camera, so I might be able to see it sometime.
Yep.
Okay.
Yep. No problem. I have been the hospice social worker for about 7 years for Lakes Regional Hospice, and Lakes Regional Hospice has been providing hospice services here in Dickinson County for over 10 years. We are a part of the hospital, as you may suspect, but our office is actually located down in Milford right now. Home care, hospice, public health. If you've ever gone down and maybe got a flu shot, it's right on Highway 71. Excuse me.
My office.
Oh, is it? Yeah. So hospice care in a nutshell, and I want you to know, very informal. If you have any questions at all or comments, please just stop and fire away, and I will answer them for you. But in a nutshell, what Lakes Regional Hospice is doing is providing a service to folks who, when they've been given a terminal diagnosis, this is somebody that has been given the diagnosis of 6 months or less to live, they have different options, different choices as to what type of care they would like to receive. One of the options that they have is hospice care, and I think we're seeing more and more folks choose to go that route. Hospice care, we're not looking to cure anything. It's what they call palliative in nature. We're just looking to keep folks comfortable. The hospice team is comprised of a lot of different folks. You know, our hospice team, we're talking physician, nurses, nurse aides, myself as the social worker, a lot of different therapies. Physical therapy, occupational therapy, massage therapy, we've got music therapy, chaplain, our volunteers, a dietitian, pharmacist. I mean, it's all these different folks that come together, and we take a look at each patient individually. What does this patient need? How can we best meet their needs? What does this family need? Is the patient at home? Doesn't matter, wherever the patient is at, that's where we can provide these services, whether they're out in the community in their home, if they're in a nursing home, if they're in assisted living, we meet them where they're at. Take a look at, I'll try and improve. If that chair, I thought you were going to start throwing stuff, but I'll do my best to. And then so the hospice team goes out and provides that additional support to folks. Hospice care is, how is it paid? It's a Medicare, Medicaid entitlement. There's a benefit built, so if folks are of that age or qualify for Medicaid, that's how it's paid. Most private insurances also have a hospice benefit, and then Lakes Regional Hospice is considered an open access hospice provider. If somebody does not have the financial means, we're still going to provide the services. We're not going to turn them away. Sometimes we also provide services here in the hospital, and I mention that because you may have heard, for the longest time, Lakes Regional Hospice, hospital-based hospice program, that's what you saw in almost every county. That's the way it was. And then several years ago, for-profit hospices started springing up all over the place, and so now we're seeing that here in Dickinson County as well. We have a competitor. And I mentioned the ability to provide hospice services here in the hospital because we are the only hospice provider here in Dickinson County who has a contract with the hospital. And that makes a difference. You know, I realize hospice probably isn't a topic that most folks just like to, hey, let's talk about hospice today. I mean, you know, it's kind of a downer, but there are important questions and just things that I think the average person needs to know. In particular, the difference between the two agencies and just making sure you get connected with whichever one is right for you. And so that's why I mentioned that as well. At any given time, we're probably working with between 10 and 15 patients and their families here in Dickinson County. A big part of what I do as the social worker after our patient has died is provide grief support to families, and I do that for 13 months. And on average, about 50 to 60 families that I'm working with and trying to make contact with each month. And one of the biggest benefits that I hear from folks when I'm doing my grief work afterwards is that, you know, they didn't realize hospice could do everything that they could do. When I mention all of those different entities, they're just amazed at what the hospice team brings. And just knowing that we were there. that 24/7, we're a phone call away. That's one of the other biggest things that I hear, folks just really appreciating that, knowing that at 3 a.m., if there's a change in condition and they don't really know what to do, boom, phone call away. We pride ourselves in the fact that we just cover Dickinson County, so we can get, if a family's needing a nurse to come out and evaluate what's going on, it's a matter of minutes before we can get there. So that's another big, I think, advantage to Lakes Regional Hospice. I probably forgot about 15 things that I could have mentioned, but does anybody have any questions? Or I think a lot of times it is helpful if folks have questions and I can kind of specifically answer what it is that folks are curious about in regards to hospice care. Yeah.
Do you, I recently had a sister-in-law that had hospice, but it was in Nebraska.
Okay.
And the nurses and people came, everything's regularly scheduled or not? I mean, like, you'll have a nurse call depending on the condition of the patient, every so many days? Or,
yep.
And do they bring the medicine, is that correct?
Yep, a couple good points there. Thank you for mentioning both, or I would have neglected to talk a little bit about those. Any of the medications that are directly related to the admitting diagnosis, that's something that the hospice program pays for. And then in regards to visits, there's what's called a plan of care. It's an individualized plan of care.
A notebook, wasn't it?
So every other week, the core members of the hospice team get together and we review every patient that we're working with. And are we needing to change something? Is the condition changing a little bit? Right now, the nurse is going out 3 times a week. Do they need to go daily? Do we need to get the chaplain out there? Does the social worker need to step it up a little bit? Whatever it is that kind of pops up, and that's, we try and individualize that approach. And so, yeah, and then and that way the family knows too, kind of, okay, Mondays, Wednesdays, and Fridays, or whatever, the nurse is coming. But again, like I mentioned, that 24/7, man, if they need us anytime, that phone call away. And yeah, so.
Are they all, are the people that make the calls, are they all RNs, LPNs? What kind of education have they had?
It kind of depends on the position, but yeah, the folks that go out, primarily that's going to be nursing staff. They're going to focus on sort of the physical. What's going on here? Is there maybe some pain? Is there some nausea? Is there some symptom? Making sure that we're keeping the symptoms controlled and the folks comfortable. Nurse aide, and they're going to be RNs. Nurse aides are going to go out and do more of the physical cares, whether it's helping somebody bathe, kind of personal cares, that type of thing. And they're trained just like any of the aides here in the hospital or somebody that you might, an aide at a nursing home. Myself, I've got a bachelor's degree. I'm a licensed bachelor of social work, and so that's my background. And that's probably, between the 3 of us, most of the visits are going to come from those people, but like I say, chaplain can go out at any time. Our volunteers are a big part of our program. We've got over 20 hospice volunteers. These are just folks that, well, in all honesty, a lot of them I think have experienced hospice at some point, know a little bit more about it. And I say it all the time, if you've experienced hospice, you get it. It's hard for me to just stand up here and explain it to where you just, oh yeah, now I really understand that. Boy, but if you've seen it in action, you really, I think, can appreciate it. The benefit of our hospice volunteers, when our patients are at home, well, regardless of where they're at, that volunteer can come in and provide that family a little bit of respite. Maybe the wife has been caregiving for her husband for weeks, months, whatever the case might be, and just need a little break. And we can schedule those on a regular basis as well, whether it's to afford her the opportunity to go get some groceries or take a nap or whatever the case might be. Our volunteers are scheduled to come in, and then the family feels comfortable. Yeah, I can leave now and still feel like, somebody's there. I can think of times where patients just wanted somebody there, just wanted somebody to visit with. Sometimes didn't want somebody to visit with, but wanted somebody there physically to hold their hand or whatever the case might be. And so,
is that the same as the Angel one that's recently been fundraising?
The what?
Angel Respite.
I don't
is
know.
yours?
No.
It isn't? Okay, because there was a group out that, and I don't know who all they provide care for, if it's only hospice or if it's, even like many times child care. I had a friend that had a very sickly daughter with a feeding tube, and she got respite occasionally because her and her husband could never go out or do a thing.
Right.
Or the other kids. And so maybe that's what the other program is. They had several fundraisers. Well, there was one in Esterville. Actually, it's Wednesday night, but there was one here. And I'm thinking it was at Pearson. I've seen it. It was in the shopper.
I know.
That's the only reason I know the name.
Prior to working here at Lakes Regional, I did some case management for folks who were chronically mentally ill, and then also had some children with disabilities. And respite was a big part of a lot of the waivers that come along with those programs, and so maybe that's the type of
It could be.
Yeah, that might be exactly what that is. Couple of things that popped into my head with our music therapy. There have been times where there's folks, we've had patients who have been completely unresponsive. You go in to visit them and there's just nothing. They won't open their eyes. But you put in that polka music and that foot starts to tap, and I mean, it's just sometimes it's trying to come up with a unique way to still reach that individual, and that's I can think of a couple of times where that's been a big kind of breakthrough or reaching that individual. Our massage therapy, we've got several of our patients who just absolutely swear by that. Absolutely love having the massage therapist come out. We utilize our physical therapy folks here to do that. I think I forgot to mention too that the hospice team or the hospice program also will pay for, if an individual might need a hospital bed, a wheelchair, bedside table, any of those pieces. They call it DME, durable medical equipment. We also provide that as well. And so another.
And who pays for that, Chad?
We get the hospice team or the hospice program. There's a per diem. There's a set rate that we get reimbursed per diem, and it comes out of that. Okay. And so it just depends. Like I say, it's an individualized. So we might have one patient that, boy, we're sending everybody out on a regular basis, and we're bringing them, just a lot of meds and wheelchairs and this and that, and so, yeah. But then other folks, maybe not so much. So it just kind of depends, but that's how it is funded, through that per diem. And yes, sir.
I want to commend your group. We had someone come to the office recently, and a hospice person was worried about their income tax. They were worried about whether their will, or somebody asked me if they have the living will or the rest of these things with the hospital. And they didn't give that advice. They probably could have, but they asked who the attorney was and had one sent to our office because this person had been there before, and the family hadn't contacted us. We were glad to know that the client was not well. But there's more than your physical health.
That's exactly right.
And they worry about these things, and they don't get to the attorney's office or call them. I think the older people are, the less likely they are to call. They want to be there in person and talk to it.
Right.
And so those of us that are retired understand that.
Yeah.
But I commend them for seeking out who they had been to before and making contact to have the law office contact them or somebody sent over.
Yep. No, that actually kind of makes me think. That's a big part of what I do too. You just the family dynamics. You never know what you're, and sometimes you think, oh, everything's going smooth, and then pow, the wheels come flying off. But if we can, as a team, try and help folks just prepare, whether it's the whole spiritually, financially, physically, emotionally, absolutely, because I'd rather have that all prepared and handled and versus after the fact, and then it's, I don't know, we're in crisis mode and it just gets really difficult. So yeah, that's a very good point.
Do you have a large turnover in help? I mean,
I've always, you know, the one thing, I always commented on that. We must be doing something right, because it amazes me how I mean, you look at our age, we've had some aides retire just because they're getting to that age. We're growing substantially, I'd say, over the course of the last, 3, 4, 5 years, and so we're adding, but maybe not a whole lot of. There might be some folks that, you know what, they just realize, hospice maybe isn't exactly what I was thinking it might be, and then and that's probably a good thing that they go back to wherever their calling is. But I don't think so. I mean, I just think our folks do a nice job. I say it's hard to explain or describe exactly what it is, but once you just see,
it wouldn't be my cup of tea.
And I know this just probably oversimplifies things way too much, but once you just, for me, it's like, you know what, this is a journey we're all going to take. There's no getting around it, and anything we can do to help folks while they're on that journey, that's what it's all about to me. So, yeah.
Do you do any pet therapy? You were talking about music therapy.
I just went to a training last month down in Ames about pet therapy, and so...
You read a lot about that, like in the nursing homes, people that have had strokes and never talked, and you bring them in a cat or a dog, and...
It's amazing. Yeah, I don't know. That might be... And listening to this gal talk in this training she's thinking it's going to be kind of the wave of the future. This is really going to, so... I guess I wouldn't be surprised, but as of right now, no. We don't...
but like say with the music, if you put a warm cat next to somebody that was, find out
cat lover, right?
Cat lovers or dog lovers or whatever,
right.
Bring them a little comfort.
Yeah, I'm an animal lover. I wouldn't mind
and
that.
Especially if they always have.
That was my thought too.
Yeah, cruise into the care center with your puppy or whatever. Yeah, that'd be all right.
She'd love it.
Yeah. Anything else that you guys are curious about, or? I
wish you would have had that service when my mom was sick, but that was 20 years ago. But it sure would have been a help, you know. When you're an only child, you don't.
Makes it difficult.
It makes it tough, but you do what you got to do, But it would have been nice to know some of these things were out there and available, to deal with it too.
I'm kind of seeing that right now with my own grandmother is ill and not doing so well, and then it's just interesting to see things from the other side. I do this and I think it's good too, because maybe I don't want to say you get stuck in a rut, but you just, you do your thing, and I'm doing my thing, but now that I'm on this side, it's like, wait a second, it gives you a little bit different perspective.
Yeah.
And so, yeah, I do see, I just think it's good to kind of step over to the other side and take a peek at things, so, yeah.
I bet our group is really good in a small county like this. When my mother was ill, she ended up going in hospice. And I didn't understand it, at the beginning, as far as once they had made the decision and were trying to present it to me and stuff. But I lived in Phoenix, and it's so big, I didn't begin to, I'm sure that either that or they didn't bring up all the services, but my brothers and sisters were all far away, so it was basically like being an only child. I spent most of the day at Mom's bedside, I ended up having to put her in a nursing home and stuff, but like I said, I think it's wonderful to have this available to families.
Thank you.
How do they set that, Judd, when they get so far, or do you make the first call, or do they make the first call?
Thanks for mentioning that too. Yeah, a lot of times it is, I think, physician driven. We'll get, it's just kind of, or a care center, Hilltop or Milford or Lake Park might call and say, hey, we've got somebody here and family is.
I'm sorry.
That's all right.
If I turn it off, I forget to turn it on, but I won't.
I hear you. But I would say probably those are the two. Directly from a facility that's needing our support, or the physician is calling and saying, you know what, I've got so-and-so that, would potentially benefit from your services. But anybody can call. A family member can call, even with questions, or you know what, maybe it's not appropriate at this time, maybe it is, so yeah, we're always happy to visit or send a nurse out to kind of...
And do sometimes, does this happen once in a while? Someone does indeed get better? And
They do, and they graduate. In fact, here recently we've had a couple folks graduate. Studies or statistics have shown most folks actually improve a little bit. Not saying we're going to go out there and cure everybody, but I think it's just that extra support, that extra TLC of all these folks coming out, that it does just improve a little bit. Yeah, so some folks do graduate, and
then they're just kind of in limbo.
Yeah, just sort of stabilize. Obviously, before we would discharge them, we make sure they're connected with whatever community resources they're going to need when we step out.
But you'll come back again.
Yep, and we've done that, back and forth, at different times. So yeah, that wouldn't be unusual to see that.
Are you from the hospital?
Yep, I sure am.
Is this what?
Lakes. Yep, that's me.
Is this?
Oh, there's a good chance you have your lifeline right through our office down in Milford. It's an extension of the hospital, but our office is actually...
Well, see, I'm macular and I can't see, I can't drive. So my son got me this.
Those are nice to have.
But this call comes right here from the hospital when they check on me?
I am not completely
familiar. Or does
familiar.
it come from Milford?
The actual unit comes from Milford, and I know that Cammie, one of our administrative assistants, she's the one who a lot of times is checking on to make sure those are working and whatnot. So yeah, it might come from Cammie down there. Yeah, so.
And this is the result of we're no longer villages, we no longer have close family all the way around us, everybody's scattered out, and therefore this is the way of having personal care with all people around.
It's a good point, and yeah, again, I guess I think looking to my own grandmother and what's going on. My mom's got 3 siblings, but it's tough. I mean, it is. It's just tough, and you start to see that. And not that I'm judgmental with other families, because I'm not, but it is. So yeah, absolutely, to have that community resource available to help families out, I think it's huge.
In small towns, it's not as prevalent.
Because there's
where
a lot of
people know each other,
Yeah.
they take care of each other, and so forth.
Right.
Yeah, but sometimes you need something higher,
Yeah.
more,
More professional.
Right.
Or a combination of both. Or,
Right,
yeah,
that's what I was
absolutely.
thinking, a
Because we
combination
do.
probably.
Here in Dickinson County, we see folks stepping up. I mean, it's just amazing to see the community kind of rally or support our patients. But yeah, absolutely. We're that little extra TLC that can help out.
There's some people, even here, live and they're so isolated, they don't really socialize or anything else, and nobody else around.
Right. Yeah. Yes, sir.
You helped a lot with a couple of my clients because the kids from far away were telling them they had to do this, and the ones here who had to do it didn't think that was necessary, and so forth. So to have a nurse or nurse's aide or a therapist come in and make the recommendation is a whole lot easier to follow than kids that are in California and haven't been here for years.
That gets tricky sometimes.
Yeah.
It really does.
You do a good job in that regard.
Walking on eggshells sometimes, but yeah, you just...
Walking on family.
Yeah, exactly. Yeah. And yeah, when it gets tricky like that, a lot of times I just try and redirect families to the fact that, you know what, this is about your loved one, and if we keep your loved one's best interests driving our decisions, we can't go wrong. And that seems to kind of get folks back to where we need to be, but yeah. Anybody else have any questions or comments? Otherwise, it's off to Cedar Falls, huh, for some of you. So I don't want to hold you up, but thank you very much for letting me come visit with you this morning.
Thanks,
Thank
Johnny.
you. You betcha.
Thank you.
Thank you. And Ted, we normally have